So I want to define, okay, what is STI, because most of the people usually just know it as STI. So let me say STI is the meaning of, or the abbreviation of it is sexually transmitted infection, and it is a public health problem. So I can say that it is the most among the top 10 diseases that cause rapidly, they spread rapidly, they cause socioeconomic repercussion, they cause family and community consequences, they are cofactor in HIV, and therefore it's remain a public concern. Hey guys, my name is Anmruka. Thank you for clicking in, and if you have not subscribed, kindly subscribe and make sure you like the video, comment, and you can also share. So in today's videos I'm going to talk about STIs, and STIs is a broad topic, and therefore I'm going to divide it in sections. So in today's part 1 video, this is part 1 of this video, we are going to talk about what is STIs and what are the general signs and symptoms of STIs. And also I want to say that STIs is not UTI, so I will be differentiating STIs and also UTI in this video. So stay tuned, make sure you watch this video up to the end, and if you have not subscribed, kindly subscribe, because we will be talking a lot in this channel, and you are also free to ask me any question what you want me to talk about in this video, in the next video. In the next video you can comment there so that I know what to tell you in the next video. So thank you for watching, and also thank you for clicking in, and make sure you share this content. So I want to define, okay, what is STI, because most of the people usually just know it as STI. So let me say STI is the meaning of, or the abbreviation of it is sexually transmitted infection, and it is a public health problem. So I can say that it is the most among the top 10 diseases that cause rapidly, they spread rapidly, they cause socioeconomic repercussion, they cause family and community consequences, they are cofactor in HIV, and therefore it's remain a public concern. So as we are continuing, STI, I want to say that STI contribute to severe pain. What I want to say is that it contributes significantly to morbidity, like it can contribute to severe pain, infertility, deformity to the genital area, severe or fetal systemic diseases, severe resistant to tuberculosis, antibiotics, and also it can cause vertical transmission to the child. The child can, when during the delivery and during breastfeeding, the child can get infection if you have STI. So STI will still remain a public concern. And also, as I continue, I'm going to say that I want to say this: pregnancy and infant waste, abortion and death of the fetus or the infant, these are, I can say they are the comorbidity factors. STI is a comorbidity factor to abortion, pregnancy, and fetal waste, and maybe fetal death. Some cannot be cured, and some may be controlled, and also some may be cured. Many times those infected with STI do not or delay to seek treatment. That is why you will get that if you are infected with STI, you usually develop complication, and we are going to look the reason why we have this complication, because STI can be treated and also they can be controlled. So what are these the reasons that are contributing factors to people for delaying them to come to the hospital? The reason why people are delaying to come to the hospital, what are these factors that making people to delay to come to the hospital or to seek treatment at the right time, because STI can be treated? So we are going to talk about that. So what are these factors that can make someone not to seek treatment, or to do self-treatment, or maybe to prescribe the drug by herself or himself and treat himself or herself at home. Number one, it is about the ignorance. They don't know. It is about the ignorance about the signs and symptoms. They don't know the signs and symptoms of these STIs. And in this video, I'm going to talk about the major signs and symptoms of STIs. And the next thing is about the stigma. Somebody feels that when they go to the hospital and they will be looked at in a way that they will be judged. Yeah, they will be judged in a way that they have bad manners or they have bad behavior in the society. That is why you find that people who are having STIs, they cannot seek treatment at the right time. They tend to delay so that they can go and buy some medication in the pharmacies and they treat themselves, and this is causing a lot of consequences that we are going also to look at in this video. The third thing about the factors that contribute or can make somebody to delay seeking treatment or getting treatment at the right time is a lack of bad attitude of the healthcare provider. You get that if you have an STI and you go to the hospital, maybe some nurses, some doctors will not attend. I'm saying some, I'm not saying all of them. Some of them will not attend to you in the right way, and you get that. Now those who come to the hospital cannot come again. They won't come again because they know the attitude that is there. The fourth thing is lack of drug in the health facility. As in our country, people like things. They don't like spending money to buy things like things that can help them. So you get that these drugs are not in the health facility. Maybe the government would have decided that those who are having STIs, they get treatment for free, and this could have helped. And because maybe the drugs that someone who is having treatment having STI can use is always expensive, and they are not always in the government hospital. So you get that people get they default or they don't complete treatment because of lack of money, and maybe because they cannot afford to get the drug at the right time or the specific drug that they have been prescribed for. The last thing is about let treatment allow rapid spread of STI and increase an overall morbidity. So people can die, people can get complication out of this STI if it is not treated at the right time. So let me relate HIV and other STIs. HIV and STIs are Kenya's most serious public health problem because of the rapid spread and inevitable death. Yeah, death that cannot be reversed. Yeah, that is what I wanted to say. So also because of the resulting problem which affect nation and development and hence the welfare of the Kenyans. So this is how they relate. Although HIV has received more attention and concern than STIs, all STIs comprise a single interrelated problem because they are cofactors. They increase the chances of becoming HIV infected, such as syphilis, chancroid, and gonorrhea. They can increase the chances of getting HIV. If you have HIV, you are at risk of getting STI, and if you have STIs, you are also at risk of getting HIV. So the high prevalence of other STI is a major cause of alarming increasing in HIV in Kenya. So I think that one is that. When I was starting this video, I said that STIs are divided into 4 to 6 groups, and we are going to look at them in a section form. So because it is a broad topic and we cannot discuss it in one video, let me just break them, and then the next video we will talk about. If you are talking about syphilis, I will exhaust on that. If you are talking about gonorrhea, I will exhaust on that. And if you are talking about herpes, I will also exhaust in that. So it is divided into 5 groups. So we have those STI that only cause vaginal discharge. Some that are causing vaginal discharge can also cause urethral discharge. So we have STI that causes vaginal discharge, and we also have STIs that causes urethral discharge. We have also others that causes lower abdominal pain in men and both in women, in men and women. We also have others that causes genital ulcer. Yeah? We have others that causes genital ulcer in both men and women. And also the last one, we will have the one that causes ophthalmia neonatorum in newborn. This is when a baby is born with eye problem. The neonate is born with the eye problem because the mother was suffering from maybe a syphilis or gonorrhea. Yeah, maybe not exactly syphilis, but mostly it's always gonorrhea. So those are the section that the way STIs have been divided. So let me talk about the signs and symptoms for the main STIs, these ones that I will be talking about. So because I said they are divided into 5 groups, so we are going to start about, because those are the signs and symptoms are the way they have been divided in those groups. That is the way those signs and symptoms manifest. So we have the first symptoms is vaginal discharge, and you get that the vaginal discharge will manifest with vaginal itching, dysuria, that is pain during urination, pain during sexual intercourse. Those are among the conditions that are in the group of vaginal discharge. And also, what are these diseases that are causing vaginal discharge? The diseases that causes the vaginal discharge, we have trichomoniasis, candidiasis, bacterial vaginosis, cervicitis, gonorrhea, and chlamydia. Those are the major diseases that causes the vaginal discharge. And we have said that this vaginal discharge will come with pain during sex, pain during urination, and vaginal itching. Those are the major signs will come when you have a condition that is grouped under vaginal discharge. So the second group, we have urethral discharge. Urethral discharge will also come with the dysuria and frequent urination. And what are these diseases that are in this group? We have the gonorrhea and chlamydia. So the one that causing the vaginal discharge can also cause urethral discharge. And the next thing, we have the one that causes lower abdominal pain. And lower abdominal pain will present with pain during sex and also pain during urination. And what are these diseases that are in this group? The diseases that are in this group are gonorrhea, chlamydia, or they can be both gonorrhea and chlamydia. Yeah. And also we also have the, I don't know if it's the 4th or the 5th, the genital ulcer. It is about the ulcer can be dirty, the ulcer can be clear, the ulcer can be painless. And what are these diseases that are causing genital ulcer? What are these sexual transmitted diseases that are causing genital ulcer? These are syphilis, chancroid. Syphilis usually have a clean and painless ulcer. That is why when you have syphilis, most of the people doesn't seek treatment at the right time, because it is just there. It doesn't cause any discomfort. So in that group, we have syphilis, we have chancroid, we have genital herpes. I think those ones are painful, so maybe somebody may seek treatment very fast. And the next one, we have ophthalmia neonatorum. The eyes of the baby, a newborn baby, will swell, the eyelid will swell, they will have discharge, may not pass like discharge, and also the baby will not be able to open the eye immediately the baby is born. So the diseases that are in this section is gonorrhea and chlamydia. Those are the signs and symptoms, major signs and symptoms in this sexual transmitted infection. So I think I'm going to stop here. Now in the next video we are going to talk about if it is gonorrhea. We will expound on that, and we see signs and symptoms, and we will be able to see the complication that gonorrhea can cause. We will be able to see, I mean, the complication that syphilis can cause, the stages that these diseases usually develop, and also you will be able to ask questions in that specific video. So thank you for watching. If you are first time in this video, make sure you subscribe and stay tuned, because the second part of this video is on the way.